Urinary stone disease, also known as urolithiasis, is a common urological problem among many people. These stones are often medically referred to as urinary calculi, and they typically originate within the kidneys. However, sometimes they can pass down into the ureters and bladder and can cause obstruction of the passage of urine. There are four major types of urinary calculi present. Calcium stones, accounting for about 75% of cases. Magnesium ammonium phosphate stones, also known as struvite stones. Uric acid stones. And cystine stones. Hypercalciuria, or high calcium in urine, is the most common metabolic abnormality that leads to the formation of calcium stones. In some cases of hypercalciuria are related to increased intestinal absorption of calcium. Some are related to hormone abnormalities like hyperparathyroidism. In addition to hypercalciuria, other factors that leads to increased formation of urinary stones include low fluid intake, family history of urinary stone disease, hyperuricemia or high uric acid levels in blood due to high intake of protein-rich foods or due to inherited conditions, urinary tract infections, and low citrate levels. Moreover, certain medications also responsible for urinary stones. Some of them include indiniver, atazanavir, silicate, and sulfa drugs such as sulfasalazine and sulfadiazine. Signs and symptoms of urinary stone disease depend on the location of the stone in the urinary tract. If the stone is smaller and located within the kidney, it may not cause any symptom at all. Symptoms usually appear when the stones pass down along the ureters. In such cases, the commonest symptom is severe loin pain, which can last for hours. The pain caused by urinary stone is referred to as renal colic. Renal colic is extremely painful and it does not respond to simple analgesics like paracetamol. Most often, this pain radiates from the loin to groin area. Other symptoms may include nausea and vomiting, excessive sweating, low urine output, blood in urine, also known as hematuria, mainly due to damage to the ureteral epithelium, and high-grade fever, which may be associated with chills and rigors. It is important to know that fever is not a typical symptom in urinary stone disease. If present, it indicates that the urinary outflow is blocked by the stone and there is a urinary infection going on, which needs immediate medical intervention. If the stone is in the bladder, symptoms might include lower abdominal pain, which is less severe than ureteric colic, increased urinary frequency and urgency, poor urine stream, and difficulty in initiating urination. Diagnosis of urinary stone disease is mainly clinical, based on the patient's history and examination findings. For the confirmation, an X-ray may be performed. And to assess the exact location of the stone, a CT scan may be indicated. If the stones are smaller in size, they may spontaneously pass out when the person urinates. However, this could be extremely painful. Sometimes medications are given to dissolve these stones, as well as to prevent formation of new stones. If the person is having a urinary tract infection, antibiotics are given. If the stones are larger to be passed spontaneously or resistant to medical therapy, surgical intervention is needed. Finally, drinking plenty of water, adhering to a low sodium and low protein diet, taking foods rich in citrate can help prevent the formation of urinary stones. Thanks for watching.